Okay, hello everybody. Uh, First, I want to say hello from New York to all my friends around the world. If you're an intactivist or someone fighting against forced genital cutting, you are my friend. And I realize that for many of you, English is a second language. So you may be struggling to understand English, and I'm struggling to speak it. So let's try to make the best of it. And if you have any questions or don't understand what I'm saying, feel free to contact me at intaction.org, and I'll see if I can answer those questions. I want to thank Mojus, Victor, and WWDOGA for inviting me to speak. Now, my comments will be from an American perspective, and that's one where male circumcision is the predominant form of genital cutting, and the practice is supported by our medical establishment and insurance companies. It's also where FGM is mostly uncommon, with many states having laws prohibiting FGM, and more laws, fortunately, are being added every month. So I realize that the American perspective is likely different from other countries that are dealing with other types of forced genital cutting and with different dynamics. But perhaps by understanding our different situations, we can learn from each other and apply that knowledge back home. So I'm the founder of Intaction, a New York-based intactivist organization. You know, America is a place of paradoxes. We're a place of incredible achievements in medical science. Yet many of our clinical doctors believe in an ancient barbaric ritual that masquerades as medicine. We're a place with some of the most prestigious universities in the world, but still a place of so many people ignorant to the harm of genital cutting. And we're a place where parents have so much concern about the well-being of their children. Yet many never give a second thought about what they're doing to their sons and their right to body autonomy. And we're one of the richest nations in the world, but a nation with little money for protecting children from circumcision. I can't tell you how grateful it makes me feel when someone from another part of the world makes a donation to Intaction, that people from other countries care and empathize with our situation here in America. It's just amazing, and I thank you. So I founded Intaction almost 10 years ago because I saw the need for taking tangible, concrete action. I put action in our name because for me, taking action is paramount for creating change. And we would be an organization that would move beyond discussion and debate, an organization that would try to have a real impact. And the last 10 years has been accomplishing just that with the resources that we've had. In that time, I've learned about what works and what doesn't work and what kind of works, but doesn't really create the change that we're seeking. So, for instance, I've done over 50 media interviews between print, radio, podcast, and TV over the last number of years, probably more than many other well-funded issue groups. And our website has had over 1 million views since we started it. We have a mobile education unit that became a fixture in New York City. We've educated, informed, and probably changed the mind of thousands of people. It's all wonderful, but it's not enough to have a meaningful impact on circumcision rate in America, because raising public awareness and changing public opinion is only half the battle. So you might wonder, why is that? If we get some significant percentage of people to understand the benefits of foreskin and the harm of circumcision, won't they just stop? Well, it's not likely, unfortunately, because people are habitual. They're bound to past traditions, and they're subject to family and peer pressure. And even if they heard about the harm of circumcision, they want to cling to the past. So when I look at other countries that effectively reduced infant circumcision rates, like the UK, Australia, or Canada now, the change happened when their National Health Service stopped paying for it. In other words, new public policy changed public behavior. Education and awareness helps, but ultimately public policy changes are needed to change behavior. So why haven't activists become involved with this or become successful in changing public policy? Well, there's a few reasons, I think. First, I think we didn't know enough. We've all been trying to figure this whole problem out. I think we've been struggling with the emotional and physical harm inflicted on us. I think we've been trying to get organized, trying to develop a base, a platform, and also trying to build confidence in both our messages and ourselves. So we struggle with a lack of resources. We also struggle, I think, with the lack of resources or the ability to hire experts we need to help us. And I think maybe we were just hoping that if we could just get the message out there, someone with power or a lot of money or a celebrity would make something happen for us. But unfortunately, it's not the case. And it's also easy to get sidetracked with theories like tipping point strategy. And that's a belief that if we just convince a percentage of people that circumcision is harmful, then they will convince the majority for us, and then it'll be problem solved. But that's really a fantasy, and it can become an excuse to do nothing but wait. So what is Intaction doing? In 2020, we started the Health Equality Campaign to engage in legislative advocacy. I think we're one of the first organizations to ever have a specific organization dedicated to legislative advocacy. First, we would educate legislators about issues important to us, and then we would try to get legislation introduced that addresses those issues. The campaign is a special type of nonprofit organization that is permitted to engage in political action and to collect money to do so. The campaign has already hired lobbyists to represent us. And the campaign is also registered to lobby in 2 states, currently New York and North Carolina. Most advocacy groups out there, I'm not talking about activist groups, but most advocacy groups have lobbyists working for them. This could run the gamut from nonprofit issue groups, civil rights groups, unions, even local governments and business trade associations. They all want representation, and it's the way things get done. The campaign has already had several meetings with leading New York State senators and assembly members. And you know what? Despite many years of efforts by activists in raising awareness, these legislators, they told me they never knew this was an issue. So the initial meetings was for them to get them to know about our campaign and what our issues are. And now we're moving into drafting some initial legislation, getting it introduced, and then we start finding sponsors. So to help us with that, with this goal and this project, I produced a public policy guide or a legislative guide, which was distributed to all legislators on various health committees. It's about a 15-page booklet, and it goes into our issues, and it makes it easy to understand for the legislators, and it's graphically appealing, and it's short and simple with key points highlighted. So we gave them 4 proposals. One is to reallocate healthcare funding away from medically unnecessary procedures, wink, wink, circumcision, and allocate that money to where it can be better used, okay? Like lower premiums or lower caps, lower deductibles, and better coverage, okay? Isn't that what people really want, okay? We're not here to take away anything from anybody. We're not here, our goal as activists is not to take away insurance coverage from low-income families with Medicaid or managed Medicaid. Our goal is to make sure they get the health care they need and that they want, and then not give them something that they don't need. So that's one issue. Another issue we raise is the issue with Mogen circumcision clamps. So some of you may know about the Mogen clamps, some may not know, but these are clamps that have a track record of horrific accidents and botches on baby boys. So we would like to see those prohibited from use in clinical settings in New York State. Hospitals have no business using these things. There are safer devices that can be used. Of course, we would like them not to do any circumcisions at all, but if they have to do it, don't use a Mogen clamp. Matter of fact, in New York, about 2 years ago, 2 babies were botched in a very prestigious hospital by the same doctor using Mogen clamps. Okay, so our guide actually provides, some of the issues with the Mogen. What is a Mogen? What can happen? And here's the newspaper headlines about what did happen. Okay, so our policy guide goes into that. Then we also raise the issue of what about a circumcision victims compensation fund? There are many men that are harmed by circumcision. They have a lifetime of issues they have to deal with, whether it's through counseling and therapy or through reconstructive and cosmetic surgery. This may not be covered by insurance if they have insurance, or maybe they don't have insurance. These issues can go on for a long time, and sometimes parents may sue for malpractice, sometimes they don't. The courts tend to award very meager amounts of money for these things because it becomes an insurance settlement and the judge wants to just dispose of the case and get it out of his courtroom. And after all, if you have some damage to your penis, what is that? That's not a big problem, right? Of course not. So we would like to see a victims compensation fund where money could be put aside to help these guys and have a board that would administer that fund. So that's our third proposal. And then our final proposal is about non-solicitation. So we all know that doctors solicit circumcisions, they pressure parents in hospitals, and they're not supposed to do this. Doctors do this under the guise, well, we're just asking. I know when my children were born, they just we just need to check to see if you want to do it because we don't want to be caught at the last minute that when you're leaving the hospital, then you want to do it, or we have to put it in the computer. But by the way, do you want to do it? And then they'll ask us again in a couple hours, do you want to do it? And of course, the mother may be recovering from anesthesia, following birth, or she may be groggy or a little bit out of it, and they're shoving a consent form in her face. It's not the way medicine's supposed to be done. Doctors shouldn't be soliciting, and so it should only be done upon request. So that's our fourth proposal. And this is the booklet we had. Our lobbyists distributed this to members in the New York State Legislature. Again, this is why lobbyists are critical. I couldn't do this. None of us can get this out. They can get it out and distributed. So at least it's in their hands. Lastly, I want to thank Dr. Opiami Param and Dr. Mark Reese from DOCS, Doctors Opposing Circumcision, for participating in our legislative guide. Their backup as medical doctors certainly adds a lot of credence to the issues we're raising, and it backs us up. So I appreciate that these medical professionals could take time out to help us with this, because really we all got to work together on this, and we certainly need the help. So I thank them. So that's our legislative guide. So I like to use what I consider to be a divide and conquer approach. Okay, we can start restricting various aspects of circumcision. Things like going after dangerous devices like the Mogen clamp, which has a horrible track record. Things like reallocating insurance coverage, maybe requiring effective analgesia or anesthesia. Some doctors feel like babies don't need it, and they don't want to do it because it takes them more time. So they just want to pass that by. So maybe we need to require them to do that. And of course, prohibiting doctor solicitation. My opinion is that to divide and conquer is more achievable and more effective in the US because of our situation than demanding sweeping changes. We can start chipping away at the problem. And being an effective advocate also means getting involved with politics. and politics start locally. And we are just now starting to try to organize grassroots groups in key districts to support our proposals. If we can organize people in key districts, we can exert pressure on those legislators. We can also support candidates that support our issues. This is where the power is. So suffice to say is that lobbying is costly, but it's crucial. The campaign is spending thousands of dollars a month to do this, but we need the lobbyist network of contacts to create change and to block actions harmful to our cause. You can't start putting this all together when a good opportunity comes up, or on the other hand, if an unfavorable law is in motion. We need to start now, and we need to keep going forward. So the Interaction Board of Directors and myself, we encourage our fellow Americans that care about this issue to support us, which you can do on our website. You know, previously when healthcare policy was debated in New York, for instance, policy that would impact what we care about, not only do we have no input, we didn't even know what was happening. For instance, now in New York, there's a proposed bill, which we got involved with, over changes to mandatory informed consent. We're now following that bill, but it's out of the Senate, it's in the Assembly now, and we have many opportunities along the way to try to insert circumcision as part of that informed consent, to make sure that, for instance, mothers are not pressured to sign it, and that perhaps if one parent objects, that's not consent, and doctors shouldn't be forcing it on anybody. So these are all things, and the mother shouldn't be just recovering from anesthesia when she gets signed the consent form, and the consent form should really explain what all the risks are, and that circumcision is a cosmetic procedure, which one hospital system in New York does do already. So if we weren't involved, if our lobbyist brought that to my attention, if I didn't have him, we would have never known that this was in play. So in every state and in every year, there are dozens, if not hundreds of changes to healthcare law and regulation. And these things are being discussed, and there was no one to stand up for genital autonomy. We may not get everything we want, but at least now we're part of the discussion. And that is what being an effective advocate is all about. So I don't want to come off as too pretentious or say that I have all the answers, but I can tell you this: if we want it bad enough, if we want to create change, we can make it happen. We just have to apply our talents, our intelligence, and with the sheer force of our will, I think we can create the change we seek. All we have to do is give ourselves the opportunity to think big and to operate at the level other advocacy groups do. Medical trade associations and insurance companies took the power to promote circumcision. It's time to take the power back. Thank you all for listening to my presentation. I hope everybody's doing well in the current state of affairs around the world. I hope things are getting better. And again, you're all my friends. If you're fighting against circumcision, you're fighting against genital cutting, you're my friend. Thank you.
There's still some questions that has reached us. Thank you very much for that absolutely interesting and fascinating presentation. Most reactions are about this proposal book of Interaction. Is it for download on the website?
It's not available right now. We will make it available at some point. But it's in a printed form. I don't have it on a web form yet.
You know, I think it would be very interesting, because that's where activism and professional work meet. And so I think it could serve as an example for other countries as well, concerning their situations with health insurance issues, for example.
Right.
So,
you know, this guide we tailored for New York State. Again, because it went to New York State legislators. If I was doing something in another state, then I would tailor it for that. You know, state legislatures are only in session for a few months a year. It's a part-time job in the states.
Yes.
When it comes to the state capitals, they only do it for a few months. So I started this in January. I really had to work very quickly to get it prepared and to get it to our lobbyists. And so fortunately, I'm good with Adobe InDesign. I got it done.
Design is great. It's very, very impressive. Another question, one of your proposals is about health measures for affected people, as I have right understood. Would that include also initiatives for paying restoration devices by health insurance is a question.
Yes, I would like to see that. I would like to see resources made available for from the fund for restoration. I think absolutely that's a valid point.
Yeah, we have one man in Germany who really achieved that goal. He made a report on the MOGA's website. There's also an English version. Perhaps you're interested and we can send it to you. It was really hard work because I think he was with 12 doctors till he finally found one who wrote them the paper who recognized the damage that has been done to him and found finally a health insurance that paid for a device commanded by the US. So this was...
That's wonderful. You know, we want to give men that, you know, a lot of men feel like, well, I've been circumcised and there's nothing I can do about it, right? So I think it's a key point of activism is that we want to be able to give men an option. They can get their foreskin back and they can advocate against circumcision because you can do something about it. So I think foreskin restoration is an important part of activism. And we want to make foreskin restoration as accessible as possible and disseminate that knowledge about how it's done so guys can get involved with it. Because right now, I think probably most people think it's a novelty, but no, it actually does work.
Yeah, and would show to the health insurances that there is really a suffering and would make them pay. So I think that could work in changing their opinion. What do you think?
You know, we were thinking that perhaps, you know, what if there was a fee charge for every circumcision done? Let's say it was $25 that the hospitals would pay, and then that would go into the fund. Our lobbyist has suggested you could put a checkoff box on the tax forms where taxpayers, when they're doing their taxes, they can check a box, and if they want $25 of their money, it could go towards the Circumcision Victims Fund. So those are two ideas we're working with. But you know, a lot of it, you know, you put it out there to the legislators and then you see what they come up with, because they're going to have their own, you know, ideas about what's the best way to do something. And then you kind of have to go with it. But we're open to all suggestions.
Thank you. And then there's one more question. Who is asking for financing MGM by health insurance? Which interest groups or lobby groups call for that?
Well, you know, the history of circumcision goes back in America about 100 years. And, you know, for doctors, it's an income stream, okay? They collect a decent amount of money for a relatively short procedure time. Hospitals bill out a lot of money to insurance. And let me tell you something, insurance companies don't mind paying for it, okay? Because they collect premiums. So the more they pay out, the more they collect, okay? Under the Affordable Care Act, which I believe currently is still the law, insurance companies, they can keep 20% of premium. 80% is supposed to be paid out in claims. They get to keep 20% as profit and overhead. So the more transactions that are going on, their 20% is bigger. So they really don't have a strong desire to cut billings because they make money off of that, okay? So that's the two things. It's the insurance industry and it's the healthcare industry, the hospitals, these hospital systems. They're all about revenue. Revenue is the most key thing. Matter of fact, some doctors groups now are owned by hedge funds, okay? And these hedge funds buy up doctor practices and they invest their money into doctor practices, whether it's anesthesiologists or obstetricians or pediatricians. They invest money and they expect a return on that investment. And they want to see billings and to go up and revenue go up, okay? And circumcision's part of that. So I hope that explains it.
Yeah, absolutely. Thank you very much, Anthony. for
Thank
this.
you, Victor. Thank you, Victor. Thank you, Mogus. And thank you to all my friends around the world.
Yes. So let's celebrate WWDOGA for the rest of the day. You're still in the middle of the day. We've now finally 12 hours of broadcast. So we will soon fall asleep, I think. Thank you very much to New York. And see you soon. Bye, Anthony.